Organizing for Action is pleased to present this forum on the Affordable Care Act with our co-sponsors, the Associated Students of PCC, along with Insure the Uninsured Project and Young and Healthy Pasadena. I want to thank everyone from OFA and PCC who worked to put this forum together. We really hope it'll be informative, and at the end of the hour, or 50 minutes really, you'll come away knowing more than you did when you got here. Organizing for Action is a nonprofit advocacy group that grew out of President Obama's election campaign. It's run by local volunteers who work on the Affordable Care Act, comprehensive immigration reform, climate change, and gun violence prevention. I'm Patty Cole-Ross. I am a physician, and I specialize in preventive medicine and public health. So this is an issue that's very near and dear to my heart. I will be moderating the session. Today we have two wonderful speakers for you who are going to go through the overall and local aspects of the Affordable Care Act, also known as Obamacare. And at the end of their presentation, we should have some time for a Q&A. So first I'm going to introduce the speakers, then they're going to speak, and we'll go through the Q&A. Our first speaker is Ki-Wan Yu. She is Policy Director of the Insure the Uninsured Project. Ki-Wan is right there. A nonprofit health policy research organization dedicated to increasing coverage for California's uninsured by building consensus among the state's health policy leaders. Ki-Wan is responsible for monitoring implementation of healthcare reform in California and reporting on its progress. Prior to joining ITUP, as it's known, Ki-Wan worked as a molecular biology researcher and studied prostate cancer mechanism. So for all of you students in here, a lot of times your education leads you places you might not think of. She received a master's in public health from UCLA and is an epidemiologist. She has an undergraduate degree in English and creative writing and chemistry from Dartmouth College. Our second speaker is Whitney Harrison. And Whitney is originally from Altadena. She grew up attending Pasadena public schools, including John Muir High School. She then went to UCLA, where she graduated with a degree in sociology and a minor in Spanish. And during her college career, she had the opportunity to study abroad in Spain for 1 year. She's currently a member of Leadership Pasadena, class of 2014, and is pursuing a master's degree in public administration through Cal State Northridge. She has worked with Young and Healthy in Pasadena for nearly 2 years as an outreach coordinator, and is very involved in the organization's effort with Covered Pasadena, which she'll also tell you about today. So first up, I think we're going to have a couple of videos. Is that what we're doing? Ki-Wan, are you doing that? So first, Ki-Wan Yu is going to come and tell you generally about the Affordable Care Act.
So the ACA has a lot of names. It's actually the Patient Protection Affordable Care Act, which is also called the ACA, which is also called Obamacare, which is also called the worst thing in the world right now by some people. I am not partisan technically, so I can't really comment on that. But it has three major goals. If we just strip all the politics out of it, the ACA, what it tries to do is increase healthcare coverage, reduce the costs, actually make it affordable, and those two kind of work together to make sure everyone is healthier. Okay? So the two major ways that the ACA expands coverage is one, Medicaid, which is a federal program that helps low-income Americans afford healthcare. In California, that program is called Medi-Cal. Although it is for low-income citizens, that doesn't mean everyone that is low income has it, and we're going to expand upon that starting January 1st. The other is Covered California. Has anyone in here heard of Covered California? Okay, thank God. Thank you for knowing what that is. Hopefully you'll hear more about it in the news and marketing and stuff like that very soon, and I'll go into more of that later. This just kind of underscores why health insurance is important. It's an awfully risky financial gamble to make because 1 in 4 people without health insurance will go bankrupt or lose all their savings because of health-related or medical costs. It's kind of terrifying. And you may have heard, you may know people in your neighborhood and your families that have gone through this, and it is truly awful to be sick or injured and not be able to pay for it or go to work because you're incapacitated. So, as I mentioned before, Medi-Cal is our state's Medicaid program that helps low-income Californians, but it's not just all low-income Californians. Right now it's limited to children, parents of those children, the disabled, and seniors. It doesn't include, say, younger Californians that don't have children. This is what it looks like right now. It's kind of piecemeal. It doesn't really cover a whole lot. So for reference, 100% of the federal poverty level for one person is $11,000, just for frame of reference. But on January 1st, it expands to include not just pockets of the low-income population, but to all adults who don't have children to care for either. So you can probably think of a bunch of people this provision could help, because you'll see that it helps people up to the age of 64 too, that earn less than $15,000 for an individual. That includes students. And right now, this is kind of what our public program looks like. It's a chart of all sorts of different programs here and there, but one big thing now is that right down here, this expands just to kind of cover all the gaps and make sure all the low-income Californians get coverage even if they don't have kids or disability or are senior. So that's just kind of the take-home message for that. If you have any questions about this, just stop me. Yes?
What about dental? That's not covered to a certain extent. Is it just for preventative, not for anything that's major?
Yes. So what happened is that for the Medi-Cal program, they removed the dental benefit for adults but kept it for children. And this last budget year, they added back in limited adult dental, which is what you're referring to, I'm guessing. And that's mostly for preventive stuff, not comprehensive oral surgery and things like that.
So are they, in the future, are they going to plan to extend that to for oral surgery?
We'd like to think so, but given the current budget situation, it's not looking likely in the near future. So there are other ways to kind of purchase dental coverage later that I'll go through. Yes, Bob?
What about vision?
Vision is only covered through Medi-Cal. It's only covered for children, not for adults. Any other questions about the Medicaid or Medi-Cal program? Nope, guess not. Okay. All right, so before I get into Cover California, which is a private insurance program, so its participants are things like Blue Cross Health Net, Kaiser, and names you know. This is not a state-run program. This is just merely housing it for public insurance. And before I get into that, I want to make sure people are familiar with new developments in the private insurance market are coming down the pike. Some of the things I mentioned in the video before is that children cannot be denied coverage for pre-existing conditions. You have probably heard all sorts of ridiculous horror stories about people getting denied coverage for cancer, for asthma, for autism, for acne, for hangnail, and all sorts of stupid things like that. But now that's out the window. Kids cannot be denied coverage whether they're really healthy or really sick. And this will be extended to adults starting January 1st, believe it or not. This is one thing that people don't realize, and it's going to make a huge difference. Yes?
That podium is blocking a part of the screen.
Oh. Thank you for that. Okay. Another is that there are no lifetime coverage limits. So sometimes right now what happens is people will need a lot of expensive care, but at the end of the year or throughout their lifetime, the insurance company says, nope, we already paid too much and we're going to stop paying from here on out. That is now illegal. You can't say that for any year or for your lifetime of coverage. The insurance company has to continue paying out. Also, as mentioned before, this you may already know, young adults under the age of 26 can stay on their parents' employer plans. This was already, I think, 2 million young adults have taken advantage of this and will continue to in the future. Also, preventive services will be free without any additional copay. So if you have to suffer a colonoscopy, at least you won't have to pay for it out of pocket on top of it. So this covers all sorts of things like vaccinations, birth control, mammograms, and things like that. Any questions so far? No? Okay. So I mentioned that pre-existing conditions are not a reason for people for companies to charge higher or lower premiums. There are 3 things now in California that can determine how much you pay in premiums. One is age. That 3-to-1 means that the oldest person's premiums cannot be more than 3 times that of the youngest person's. So a 64-year-old's can't be more than 3 times that of a 19-year-old's. Okay? Geography, in the case of California, it's been chopped up into 19 different regions because not all regions are the same. Everywhere has a different cost of living, a different cost of healthcare delivery system. So LA actually has some of the lowest costs in the entire state because we're so awesome and so competitive. So yay, LA, and go Dodgers. And I'm terrified right now for the team, but family size is the other one. Because obviously if you want more people in your family to have coverage, it'll cost you more. And that each additional person is determined by the age and geography as well. Does that make sense for you guys? Yeah.
Just to go back to the age, the 3 to 1, show is the oldest person in the family?
Oh no, this is just kind of statistically when insurance companies come up with their plan rates, the highest end that the insurance company will cover up to, which is the non-elderly up to 64, and the 19-year-olds, that's a 3 to 1 kind of band that they limit it on. So a 64-year-old can't be $301 if the youngest person is $100. Does that make sense? Okay. We'll get into some actual costs later. I'll show you what the market's like in LA. So the other thing is, from here on out, all insurance plans have to meet these 10 essential health benefits. And this includes hospital care, inpatient, outpatient, pharmaceutical, labs, diagnostic, rehabilitative, habilitative. One big thing is maternity and newborn care. A lot of plans in the past have been very selective in whether or not they cover this. And some women become pregnant, realize they're SOL because their insurance plan doesn't cover it. And it is really expensive to have a baby in this country. And now that's fortunately covered. Another is mental health and substance use disorders. This was something that was often left out or very patchy and people didn't know what services are covered, if at all. Now this is something that has to be covered. And for children, dental and vision is covered, but not for adults. So a really healthy 25-year-old and a really sick 25-year-old will pay the same amount of money if they're in the same zip code and they choose the same plan. Does that help? Mental health, so if you want to see what exactly is covered in terms of how X number of visits or X number of whatever, you can refer to the Kaiser Small Group Plan 30, because that was the benchmark that it was all pegged against. So it has to cover at least that. So if you look that up, I don't know exactly what's covered and exactly what's not. I'm sure to a degree it is. I don't know if it's fully, that you can investigate that more. If you can talk to me afterwards and we can look into it. Any other questions? Nope, okay. So you've probably heard about this. It's ruffled some feathers. So the individual mandate. Starting next year, people will have to have health insurance or they will get penalized. The one thing I want to tell you is that if you have health insurance now, whether it be through your employer, Medicare, Medi-Cal, unions, or the VA, that counts. It can be the most bare bones plan you got, that still counts. It's grandfathered in as long as you continue it starting next year. Okay? So this is the part where people conveniently leave out. There are exemptions to the individual mandate. The most important being financial hardship. If you are deemed as having a financial hardship, and that's defined as if the cost of the most affordable coverage to you, the premiums, is more than 8% of your income, you're exempt. You do not have to buy health insurance, and you will not be penalized for not doing so. But one very, very important thing is if you fall into that category, you will most likely be eligible for Medi-Cal, which is free. You will have all those benefits I mentioned before, and maybe a little more, because Medi-Cal covers some more mental health stuff. You will get that for no cost. So look into it. If you have any questions, come up to me afterwards and I can help you, or Whitney too. The other is mentioned below. So also religious exemptions. Undocumented immigrants, unfortunately, undocumented immigrants are for the most part left out of the ACA. They will not benefit from a lot of the provisions or coverage expansions. So on the flip side, they won't be penalized for not having insurance. And incarcerated persons are also exempt as well. California is very mindful of that, knowing we have a very great diversity in family types with mixed status families, and they made sure that it will not ask for the parent's social security number, it would only ask the child's when applying. So there is some cloud cover in that regard. Any other questions? No? Okay, so with any with any rule there's a penalty. So for people that do choose not to have health insurance, it's right down there. $95 or 1% of your income, whichever is higher for 2014, and then it goes up. Okay, and then you'll see what it goes up to later. Okay, this is just, healthcare is really expensive. Have health insurance, that's the point of that and that. So these are just terms if you are unfamiliar with private health insurance. I'm just going to go through it really quickly. Premium is what you pay every month for health insurance. Copay is what you pay when you actually see the doctor. All right, so I got the time warning, so I'm zooming through this. Covered California is our state's health exchange, and this is the marketplace that's going to house all these private plans that you'll be able to choose from, and you can actually make an informed decision because there's a lot of information on it, and it's in multiple languages that'll help you. So, all right. So the plans that are participating in the exchange, they all have to cover the 10 benefits I mentioned before, and they will all have the same. There are different tiers, and they all have the same copay, so you can actually compare. So you have to compare a plan with a $5,000 deductible with $30 copay versus a $2,000, you know what I mean. It's a pain in the ass before, it'll be less of a pain in the ass now. So the 4 tiers, the platinum, gold, silver, and bronze, those percentages mean that for a platinum plan, the insurance company will pay for 90% of expected medical costs. And it goes down to bronze, which is 60%. What this actually means is that, this shows it better. For bronze plans, you pay less in premiums, but more for copay. So if you anticipate going to the doctor not frequently, this plan might be right for you. Because then you just pay more when you actually see the doctor, but if you're not going to see the doctor frequently, then it's not as much of a burden on you. Whereas platinum, if you're going to go see the doctor a lot, this might be better for you. This is a personal decision you'll make based on all the information, all the plans, which I'll show you. So these are the plans participating in LA. Don't worry about the shop part. That's for small businesses, which isn't up and running yet. And subsidies. Yeah. Sorry. It's because we don't, this is usually a 3-hour thing that we do, and we got down to 30 minutes. Yeah.
But you can get the information online at Covered California.
Okay.
We're going to take you onto the website, and then you'll see a whole bunch of
Is
stuff.
this display on the website by any chance?
Sorry?
Yeah.
These slides?
The presentation?
Yeah, you can.
You can download it's on our website. You can download everything on all the videos. All that good stuff's on there. Yeah.
What's your website?
itup.org.
Each one of those insurance companies are going to have to provide a comparable minimum benefit. But I understand that some will have larger networks of hospitals and doctors that will accept their insurance and some will not. Is there a way to find out in advance what those networks are?
When you go to Covered California, the coveredca.com website, when you try to choose a plan, you can type in your doctor's name and see what insurance that doctor accepts and make a decision based on that. So it'd be like,
If you have no doctor, if you're young and you've never been sick, is there a way to find out which ones cover more and which ones cover less?
they all cover the same benefits, right?
I'm talking about networks of doctors and hospitals.
I believe that information will be available when you look at all the plans so you can compare. Yeah.
It might be useful. It might be
I
useful.
was reading the LA Times the other day.
I just want to make sure, so all this talk about Covered California stuff, that there are federal tax credits and subsidies, there is financial help to you to make healthcare affordable depending on what your income is, because affordability means very different things to very different families and individuals. So if you make between 133 to 400% of the federal poverty, which is 400% for one person is about $45,000. That's the upper cap that you will get assistance in the form of tax credits. So what that means is for someone earning 133% of the federal poverty level, which is $15,000, you will not pay more than 2% of your income towards health premiums, and that's $27 a month. For a private plan such as a Health Net or a Blue Cross and other things like that. 133% equals $11,000 for one person. 400 is about 45,000. So, and on the upper end, you'll be capped at 9.5% of your income. It's a sliding scale, so you can see what the max will be depending on how much you make. So, okay, so these are the costs for a 40-year-old single. Oh, okay, let's go 25. These are the actual costs for LA for a 25-year-old. And this is before any sort of premium assistance. This is a full sticker price. These are the plans, and you can see that everyone participates in each tier. So Anthem has a product in each tier. Blue Shield has one. You can see HealthNet has a PPO for the lower tiers and an HMO for the higher tiers. They have the option of doing that to kind of be more innovative and keep costs down. Oh, shoot, okay. That was a 40-year-old, 25-year-old. And it does go up, you'll see, with age, because statistically, the older you are, the more healthcare you seek.
Stupid question, but is that per month?
Yes, that was per month, and these are before any sort of premium subsidies. They can be as low as $27, but depending on your financial circumstance.
What's an EPO versus a PPO?
EPO is what's the difference?
Isn't that extended to
Yeah.
longer?
It's like a beefed up kind of PPO. Right.
More
doctors or
And more specialists.
Yeah.
more specialists?
You can see when you actually compare the products that you can kind of see what the networks are like and what doctors are in it. So the additional thing I want to really quickly mention is that we talked about the financial help for that was for monthly costs, for premiums. There's additional cost sharing subsidies for how much you pay when you actually see the doctor. And there are protections for people between 100 and 250% of the federal poverty level to make sure you don't pay too much when you actually go to the doctor, because those $30 things can add up to quite a bit. So really quickly, this is only for silver level plans, but on the far over here, this is how much you would pay if you didn't have that cost protection. You would pay $45 for a primary care visit. That is pretty hefty, but if you make under $17,000, that drops down to $3. So I mentioned really quickly before about the actual value. Platinum was 90%, silver was 70%. Considering all those cost sharing protections, this silver plan product is actually better than platinum because it's 94%. But this is only if you make between 100 and 250% of that federal poverty level, and you choose a silver plan. So if you think you're in that kind of income range, look at the silver plans first before making a decision, because that can really, really help you when the costs add up. All right, let's see if that's loaded. Oh, loading. It's been really popular, so it's been kind of slow. So how you do this, the federal government toyed with the idea of having people just spend all the money throughout the year and then getting reimbursed for that later, like rebates, which we all hate and are awful and suck so much. So instead of that, what they did is that you estimate how much money you're going to make so that you get the subsidies as the year goes on. Does that make sense? Instead of getting a big refund at the end, because most families or individuals can't take on the burden of thousands of dollars throughout the year. So instead, you kind of go through the year, and based on how much you make, they'll give you the subsidies every month. And if your income changes, please go online and just change that information, because you could be eligible for more subsidies, or you might have to owe some back depending. It's a fun relationship with the IRS that'll continue. Okay. Open enrollment started October 1st. You may have heard about it. It's going to continue on to March 31st. And outside of this period, you cannot buy health insurance. So please buy it before March 31st. There are some exceptions to it, like that. Anything that causes a change in your insurance status, whether you lose a job, get a job, marriage, divorce, have a kid, things like that. But even then, you have to apply within the first 60 days of that life event happening, or else open enrollment is closed to you again. You have to wait to the next open enrollment, and you have to pay the penalty for not having health insurance. Got it? Yeah.
When the next new enrollment will be?
October to December.
Oh, it's always going to be that time?
But this is, for the first time, is in a special 6 months that goes to March. It's not going to be the case every year for that.
If you enroll now, you're covered January 1st, but you can
Yes.
still enroll.
Okay. This is just a quick kind of overview. Medi-Cal, you can apply anytime. Cover California, you cannot. That's just how the private insurance market works. You have to buy coverage during open enrollment, and then you stay with that plan for the year. And then you choose again the following year, and repeat, recycle. So this is our information. If you need the slides and everything are on there, the presentations. If you have any questions, you can email.
My name is Whitney. I'm from Young and Healthy. We're a nonprofit organization right here in Pasadena. And our mission is to provide free health services to children who are uninsured or underinsured. So servicing the uninsured population has always been a mission of ours. And so we are definitely taking a role in the whole Affordable Care Act, and especially coordinating the effort right here in Pasadena. So I'm going to talk to you a little bit about the local effort right here in our home city. So just first to give you some background information about Young and Healthy, like I said, we provide free health services to uninsured children. We will continue doing that because right now in Pasadena, there is an estimated 28,000 individuals who are uninsured. And if that includes about a third of our school district. And so a third of the students in PUSD go without insurance daily. So that's the statistics we're looking at in Pasadena. Now, if we do a great job and get all those people that can get enrolled in these new programs, still 7,700 individuals will go uninsured. So there's still an effort to serve the uninsured, and Young and Healthy's, staying strong in that. What we do to get health services to kids is we have doctors donate their services. So this is a nice little infographic about how it works. Each doctor or dentist or specialist decides what they can donate, and when a child gets referred to our program, we do that. So we do that for 0 to 18 or until they finish high school, and then up to 25 for emancipated foster youth. And we'll continue doing that. We also are doing Medi-Cal applications and Healthy Way LA applications now, so we can help them that do it as soon as possible. But so piggybacking on what we're talking about today, the Affordable Care Act, I wanted to just talk to you about Pasadena and what we're doing right here. So Young and Healthy is coordinating, so it's covered California is the state level, but you know there's a Pasadena way that we have here, so it's called Covered Pasadena here right here at home, okay? So if you see the yellow umbrella around town, that is us. So that includes Young and Healthy, that's me, the Public Health Department in City of Pasadena, Bill Moore Community Clinic, that's on Lake Avenue. It's a low-cost clinic that services uninsured and individuals with Medi-Cal or on a sliding scale. Also CHAP Clinic. CHAP Clinic has several different locations throughout Pasadena and even into El Monte. They are doing a lot with the outreach efforts as well. So we're working with them. And Huntington Hospital. So that is the coordinated effort right here in Pasadena. That is so, this doesn't always happen in Pasadena, but everyone's on the same page. We're working together. So this is a good thing. We've been talking for months about how we're going to head up in Pasadena. I know. Think about it, talking to people. So Covered Pasadena, that's our flyer here. It was at the front. If you see, there's 2 phone numbers on this flyer. There's the Public Health Department at the top and Young and Healthy. So Young and Healthy is definitely taking a central role along with the Public Health Department to make sure that if anybody needs an appointment, they can get it. So when we were talking about that it helps if you, to apply, it's better to do it with help because there's also an estimate that 80% of people that go on to Covered California will not know how to do it correctly. So that's a big number. So don't feel incompetent if you can't. It's tough. It's confusing, especially if you haven't ever enrolled for insurance before. So Young and Healthy is making an effort to make sure that as many people are available to assist you with these applications as possible. So unfortunately, right now, Young and Healthy, no one in Pasadena has actual certification to do these applications yet. That there's a reason for that. That's government time we were talking about. So unfortunately, we're not authorized right now to do these applications. I know the Public Health Department has just gotten accepted into the program, so they're getting certified in 2 weeks. So we'll begin appointments at that time. So we're looking at November. There's a sign-up sheet at this desk. If you are interested for help, put your information there, and I will call you, or someone from Young and Healthy will call you when the appointments are available, and we will give you an appointment in Pasadena. So what we're doing, Young and Healthy's role, is with all these partners, and including not just them, but also the Planned Parenthood and the parks and community centers here in Pasadena. All these different folks are going to be certified to do these enrollments. And so what Young and Healthy is doing is holding the common schedule. So we're organizing what times everybody is available to do these applications. We'll have a schedule created in real time. So you can call Young and Healthy, but make an appointment to apply, at the Public Health Department. Yes, sir.
One gets certified, can they apply with you guys? Can they help you volunteer?
Yes, definitely. We encourage that. Talk to me after if you're interested. Yes. Definitely. We love volunteers. We base our organization on it. So yes, let's talk about that. There's a lot of process. You have to go through liability and you have to get background check and everything because you're looking at people's socials, their income, everything like that. So you have to make sure that you're not going to commit fraud. Oh, speaking about fraud, if anyone ever tells you that they are charging for assistance, that is illegal. So you should never, ever, ever pay anybody to apply for one of these programs. Okay? We have a lot of really smart people in this country and not everyone uses it for good. So make sure you do not ever pay anything for that. So the idea about Young and Healthy is that we're making this centralized role. So unfortunately, like I said, we would have loved to be up and running on October 1st when, it went out. Unfortunately, it hasn't gone out that way. But what we're doing is we want to take your name and number and address now, and as soon as we have that schedule started, we will call you and see what works best for you. And then as we get going, we'll also have, hopefully have some hours on the weekends, in evenings, make it as convenient for people as possible to actually get enrolled. Yes, ma'am.
I just want to know if you wanted to act on it today.
California, I believe, has on the phone to help. I don't. In Pasadena, there's actually not anyone, and at least in the public sector, and I don't believe there's anyone in the private sector either. Kind of like the presentation you heard now, we're doing that on a local level as well. It's available in English or Spanish, so if you have a group that you want to have come and have some information, with your own specific group, talk to me. Definitely, we'd love to work with you. And so So that's, and also if you have questions, call us now, because we do know a lot about what's going on, and if we don't know the specific answer to your question, there's a lot of complicated cases, and it can get into it, so we don't necessarily know all the ins and outs yet, but we know who to talk to. So we would, hang out with you and get back to you. We want to make sure you get the information you need. Then there's also, that's for enrolling, but in the meantime, there's still efforts in Pasadena to serve the uninsured, that group of 7,000 people who will go uninsured, and that's just assuming that everyone does enroll. In this first year, there's going to be people that miss the timeline, and so Young and Healthy, Huntington Hospital, CHAP, and Bill Moore will continue to service the uninsured for health services. Yes? No, you do not. With the law, you cannot deny anybody. So if you work in Pasadena, but you live out there, no, come to us. Absolutely, you give us a call. We want to see you. For Young and Healthy Services for children, that's the Pasadena area. But for enrolling in insurance, no, that is everybody. And so if you want to contact us, that is our phone number. We have flyers at the front. You can look at our website. If you want to email, my name is Whitney, WHITNEY @yhpasadena.org, and I would love to hear from you and help as much as I can.